by the numbers. Zeroing in on 5 zip codes in the heart of America, where the new face of COVID-19 is Latino, where taking off days from work is not an option, going to the hospital not affordable, and fear of immigration enforcement ever present.
My mom was gonna stay in the hospital and that she could die. That was my biggest fear.
For many immigrant workers, one donation can mean everything, following a nonprofit advocate dispensing some much needed relief.
So we're gonna give her check and hopefully that'll help.
Plus, actor and advocate John Leguizamo giving back to the Latinx community.
You would think, all right, this COVID is going to be, equal for everybody, but it's not. It's always to the communities who have to work, the working class. I mean, and we Latin Black people are the biggest working class in America.
This is a special edition of Nightline, Pandemic, A Nation Divided.
I still don't think that is real.
On the south side of Chicago, 2 weeks after testing positive for COVID-19, Estefania Ramirez can't help but wonder why.
When it started, I thought that I was gonna get it if I went out to the stores, my job, but I never expected that I would get it inside my house.
Victim of her own home, the apartment she shares with her parents and 2 younger siblings. Sheltering in place in a household full of essential workers only made matters worse. She works at an Amazon warehouse, her dad at a meatpacking plant.
And I felt kind of helpless in a sense because I knew that if one of us got it, we were all gonna be exposed to it.
Ramirez thinks it was her dad who brought the virus home.
A lot of people got infected and he came in contact with one of the people that tested positive for it.
For her mom, Maria Ochoa, first came the back pain, then the body aches and fever.
Sentí que mi cerebro sentía por dentro que estaba súper grande y aparte de eso sentía muy caliente, que no sé, sentía como que estaba en un horno.
Estefania rushed her mom to the hospital.
Thinking that my mom was gonna stay in the hospital and that she could die. That was my biggest fear.
The Ramirez family, like so many of their neighbors, know this is the risk they have to take in order to bring food to the table. Chicago, the city that came back from the ashes more than a century ago, now finding its footing amidst another tragedy. First, COVID-19 ravaged its black community.
Chicago's African Americans accounted for over half of our city's cases.
Now, this fast-moving killer taking hold of yet another group.
The face of COVID in Chicago is turning into a Latino.
Why do you think that is?
Latinos are a big part of the backbone of the economy.
Almost half of all those infected in the state are Latino. The majority of positive cases can be narrowed down to these 5 zip codes, all in Cook County, outlining what's known as the heart of the Latino immigrant community in the Midwest.
You walk into Pilsen or a little village and you feel like you're in a different country at times even.
In these black and brown neighborhoods, working from home isn't an option. Many here are essential workers, some undocumented. Their community chronically underserved and often ignored.
The disparities within the community were obvious for years. And so having a pandemic like this has only exacerbated the issue.
The death toll in this county, more than 3,000. Painful, but no surprise to those who live here. The statistic laying bare the divide these communities have felt between those with privilege and those like them.
Keeping yourself healthy is a privilege, and it's a privilege that a lot of our communities don't have.
Inside many of these homes, there's a multi-generational family, close in kinship, even tighter in space.
This is our dinner table. My brother and sister used this to take their online classes and do their homework.
For the Ramirezes, the moment they started feeling symptoms, there was nothing they could do.
This is my room where I spend most of the quarantine here. I heard that you had to isolate from everybody, stay in one room, but I knew that it was not gonna be possible for us because we use everything, the same bathroom.
To them, it was clear they'd all fallen victim to the virus. But they say the economic side effects is what worried them more.
No me siento así tan segura porque yo no cuento con un seguro médico.
A mixed status family, some U.S. citizens, others in the process of seeking residency. None eligible for stimulus relief, all out of work. A medical bill would mean sacrificing their savings.
My parents kind of think twice about going to an emergency room or going to get checked by a doctor.
Which means many are waiting until their symptoms are severe before even getting tested.
When it came back positive, I was like, oh, it's real.
Frustrated by the lack of resources, community activists are taking matters into their own hands. In Little Village, an army of sorts readying for the day. As lines begin to gather outside.
We want to try to make sure the individuals that are given that overflow time spot, that they come in between those times, not before or after.
Jerome Montgomery runs Project Vita, a fixture in the community for 28 years. Their focus is usually on HIV and AIDS, but 7 weeks ago they pivoted to COVID-19 to bring much-needed testing to this community.
We wanted to bring more services into the community because we knew this pandemic was impacting the Latino and African American communities.
Project Vita joined forces with another community leader, Howard Brown Health.
We're able to see an individual regardless of their documentation status, regardless of their ability to speak English, or regardless of their ability to pay.
That's one of the reasons the clinic's intentionally tucked away in a quiet corner of town.
It definitely helps to remove some of the stigma. It also helps to remove some of the fear.
We've seen at least about 35 to 40 patients at this time.
Drew Guzman is one of the doctors here.
One thing that was really salient to me was seeing a lot of families coming in who were getting tested after having a relative pass away, and that's something that has kind of really stuck with me.
Typically, more than 50% of the clinic's patients test positive. More than 80% come in without insurance.
I don't think people understand the true public health issue that it is. If we're unable to provide services or care to populations that are vulnerable, it will too get to those rural areas or those less populated areas.
After every positive result,
Buenos días, estoy llamando de la clínica Howard Brown.
A team conducts contact tracing, tracking down all those who may have come close to the infected person. As long as the lines keep forming, Jerome and his colleagues will keep working.
I'm here at 6 o'clock in the morning and leave at 11 o'clock at night. We have some amazing people out here on the front lines, the doctors and nurses. Those give you some hope, but we still have a long way to go.
This thing is taking out entire families. It's also the fact that when you're poor, you can't eat very well. When you're poor, you may not have access to medications to make you feel better. Physical distancing is a privilege, and keeping yourself healthy is a privilege.
It's that I share with you what the front end of the hospital looks like.
Dr. Marina Del Rios is an ER doctor at the University of Illinois Hospital.
So I just finished my shift. Almost every patient that I saw that was COVID positive was Latino. We had one death.
What I'm seeing is that in the minority neighborhoods, especially, the number of positive cases is twice and sometimes even 3 times the number of positive cases that we're seeing in white, more affluent neighborhoods.
So where you live matters.
Absolutely.
One of the cumbersome things about COVID life is having to put all of these layers of personal protective equipment.
A proud Puerto Rican, Dr. Del Rios stands out in the field of medicine where less than 6% of all doctors are Latino.
When you're looking in the eyes of some of these patients, are you sort of seeing yourself and your family, your history?
Yeah, it's unnerving to see that I'm seeing more and more people walking in that look like my tios and tias, or that could, that remind me of my mom.
Buenas tardes.
Dr. Del Rios is part of the Illinois Latino COVID-19 initiative, which launched last month in response to the crisis.
We're here not because of COVID, but because of decades of structural racism that have kind of built up to this.
When a person of color walks into a hospital, are they already sort of stepping in at a disadvantage?
There are multiple studies that have demonstrated that when you're a person of color, you are more likely to be triaged as less urgent. for similar illnesses as a person who's white. We know that patients that are in pain, that are Black and brown, are often not treated with the same amount of pain medication that people who are white. And when you compound that with the language barrier that Latinos have, then that problem even becomes amplified further.
What's the lesson in all of this for us as a society?
You're only as healthy as your most vulnerable members of the society.
After 2 weeks, Estefania and her family have recovered from the coronavirus.
I knew that we were gonna make it through, so I knew that I had to put my health first.
But now they're going back to work and know they are risking it again.
What I need to have to feel back to normal, I think, is having a cure for the disease and also having a vaccine for it to feel safe that I won't get infected again or my family.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.